In San Diego in 2025, SHARP Healthcare, that is SHARP Hospitals, SHARP Doctors, and SHARP Networks like Graybill or Arch Health, which is now Palomar Health Medical Group in North County, are some of the most asked networks from our clients. And that always ultimately leads to a choice between the two plans that do the best, in my opinion, of working with the SHARP network, which is the UHC SHARP Medicare Advantage from United Healthcare, and the SHARP Direct Advantage VIP plan from the in-house SHARP Insurance Department. So what's the difference? Is it apples and oranges? No, it's more alligators to crocodiles. Like, I think they have different shaped heads or something like that. That aside, here are 5 things to look at on the UHC SHARP Advantage plan in San Diego in 2025 and the SHARP VIP Medicare Advantage plan. Hi, Michael, and this is Michael's Medicare. And if you or somebody you know is trying to figure out what is the best Medicare option for them this AEP or really all year round, give us a call at the information down below and we can help them to make those tough Medicare choices. Also, don't forget to like and subscribe. So why at face value are there 2 plans that have partnerships with the SHARP Hospital and Doctors Group? Well, it's pretty obvious in the case of the SHARP VIP plan to have a contract directly with SHARP because they are the SHARP health insurance wing of the SHARP Hospital network. So it'd be kind of weird if they didn't have that. But in the UHC, the United Healthcare side, the main reason is that they are a big player in San Diego and really nationwide and have had a legacy SHARP branded plan from way back in the day, while the SHARP plan is still pretty new. It's got that new Medicare Advantage plan smell to it. So yeah, they're both kind of occupying the same evolutionary pond, sort of like crocodiles and alligators. Yeah. First up, and I think it a bit on the nose for this video, but it should be said, is that the network on both of these plans is going to be the full SHARP network. So whether it is SHARP Community Medical Group, SHARP Community Medical Group North Coastal, SHARP Community Palomar Health Group, and really the whole kit and caboodle, the whole family of SHARP networks, got to be a network on both of them. Next up, when one of our clients asks what is a consideration for either the UHC SHARP Advantage plan or the SHARP VIP plan, we will usually start by discussing the maximum out-of-pocket limit on either plan. The maximum out-of-pocket, or the MOOP, is the most amount of money that a Medicare beneficiary enrolled in a Medicare Advantage plan can spend during the year on their healthcare services. These are things that would normally be covered under Medicare Part A and Part B, original Medicare, but are being taken over by the selected Medicare Advantage plan, whichever one someone chooses. When we look at the UHC SHARP Advantage plan, we can see that the yearly healthcare cost limit is at $3,300 per year. If we take a look at the SHARP Direct VIP plan, the maximum out-of-pocket for that plan is $2,900 for the year. It must be noted that with either of these benefits, these costs do not include the total universal costs that Medicare beneficiaries have, because one very big cost that many Medicare beneficiaries have, prescription medications, are not included in the MOOP and can really vary depending on a person's medications that they are taking throughout the year. But luckily, because of provisions in the Inflation Reduction Act now coming into place in 2025, those prescription drug costs will be limited to a maximum of $2,000 a year, regardless of which plan somebody chooses. Another thing that always seems to hit home for our clients, I imagine because of the fact that it is almost everybody's most common interaction with the healthcare system, is the difference in cost to go see a doctor, whether it is the primary care physician or a specialist or sort of anything in between. Oh, also telehealth is available too. So on the UHC SHARP Medicare Advantage plan, the cost to go see a primary care physician is at a $5 copay for each visit, meaning it is the set amount of money that has to be paid for each of those services. In the case that somebody does need to go see a specialist doctor, so that could be a podiatrist or an ophthalmologist, I like to, I just like that word, ophthalmologist. It would still be a referral required from the PCP, the primary care doctor, and under either of these plans, because both of them are HMO or Health Maintenance Organization plans, but the cost on UHC SHARP Medicare Advantage plan to see a specialist is $35 copay. Inversely, if we look at the SHARP Direct Advantage VIP plan, the costs for either the PCP or the specialist are going to be $0 for both. Oh, you know what? I almost forgot. Telehealth for somebody choosing UHC SHARP plan or the SHARP Direct plan, the cost to talk to a telehealth provider is set at $0. And really, frankly, is always a great benefit if it's, 1:30 in the morning, it's snowing in Southern California, and you have a cough and you think, well, maybe it's something crazy, or, maybe it's just something you can wait till tomorrow, and you need some personal advice. You get the point. Call it tele people. $0. Why not? For our clients who are hard of hearing and may need hearing aids to help them with their daily lives, I think this is really something to look at on either the UHC SHARP plan or the SHARP Direct VIP plan because, well, I mean, those little electronics, they can be crazy expensive. Luckily, there is a hearing aid benefit available on the UHC plan with a two-tiered system, meaning that a person could get the standard level of hearing aids, which can run between $99 and $829 for over-the-counter ones, or they can get the next level up that require prescriptions that start at $199 copay and go all the way up to $1,249. And most interesting to note, these are going to be covered, two of them, every single year, so every 12 months, which I'm not sure, how long hearing aids last, but I know they can get lost. So being able to get them every year is a pretty good benefit. On the other hand, on the SHARP Direct Advantage VIP plan, hearing aids are going to be covered at an allowance of $3,800. So that's how much is allowed to be spent on them on whichever hearing aid a person would like to choose. But they are going to be limited to a pair every 36 months, so every 3 years. Now, it's that kind of stipulation of time that really does make a big difference. Also, depending on, let's say, the lifestyle and forgetfulness and necessity of hearing aids will come into play in a big way on either of these plans. Lastly, as we are talking about extra benefits that are included on the UHC SHARP Advantage plan and the SHARP Direct Advantage VIP plan, let's talk about dental. Because teeth are important, and it seems that they start turning to glass as folks get older, and taking care of them can require more maintenance than a 1968 Chevelle. Oh, so beautiful. Anyways, on the UHC SHARP Advantage plan, there is a standard basic dental coverage that is automatically included. And this was really going to cover things like preventative measures, cleanings, x-rays, and a few dental services at a set copay. For those folks who want the literal platinum coverage, there is a platinum dental rider that will add a lot more spend that can be used towards dental services like deep cleanings, bridges, dentures, root canals, etc., but for a price, in fact, $54 a month. Similarly, on the SHARP Direct Advantage VIP plan, it actually does come with an automatically included comprehensive dental coverage. And despite how it sounds, comprehensive doesn't mean everything, but it really means a lot more than the basic dental if we want to look at it that way. Additionally, on the SHARP Direct Advantage VIP plan, there is an option to change the dental coverage to a PPO version of that coverage. So it's still the comprehensive coverage, but it is a PPO, allowing for a larger group of dentists to be seen and get some help paying for those services, but that will come at a cost of a $40 premium a month. All right, so there you have it. Two plans that have similar, if not identical, doctors networks that are going to really be ideally suited for someone who lives in San Diego, who lives in the year 2025, and wants to be able to utilize their healthcare services at one of the many SHARP hospital networks around there, or doctors networks as well. Now, obviously, there are some differences for each of these services through each carrier, and I really think it just comes down to the cost for each of these plans to maintain the coverage. SHARP is sort of doing everything in-house, and they are local in San Diego, and they are relatively small, which changes sort of their risk profile. UHC, though, United Healthcare, does have a need to please its shareholders, and perhaps some additional administrative costs that change the way that they price their plans. Oh, on another note, one thing in closing, I would say from our experiences with our clients is that the SHARP Health Plan is a much more like boutique style experience. They don't have huge call centers or complex systems to get appeals and grievances or issues with clients addressed, where UHC is a massive corporate giant. Sure, there is some security in working with one of the largest healthcare providers in the country, but you don't sort of get that hometown feel. I'm not sure what the value of that is, but it is one thing that our clients definitely notice. All right, so that's it for today's Michael's Medicare. Take a look at the SHARP Direct Advantage VIP plan, and also looking at the United Healthcare SHARP Advantage plan, available in San Diego in 2025. And if you or somebody you know has a question about their plans, or really any plans related to Medicare here in California, please feel free to reach out to us at the information down below, and we can assist them over the phone or in our offices here in Southern California in English or Espanol. And also, if you could, don't forget to like and subscribe so you can get updates when our newest Medicare content comes out on the socials, on YouTube and on Instagram, because we have new Medicare content coming out every single week and even double that during AEP. So with that being said, for Michael's Medicare, I'm Michael, hoping that you have a great rest of your day, and goodbye.